Welcome, Facebook viewers. There's no shortage of topics to discuss that affect the profession that we at Henry Schein serve, the dental profession. So many things are happening in the profession, in the marketplace. A time of real dynamic change, whether it's practice models that are changing or technology that is finding its way into the practice, the choices that the dentists have, or all of the dynamics that are taking place with regard to patient demand and also reimbursement issues and reimbursement challenges and opportunities. All of this affects the health of the profession, and it also affects the health and the bottom line of the dental practitioner. Welcome to Henry Schein Chats. I'm Jim Brslawski. I'm the president of Henry Schein and the CEO of our Global Dental Group, and I'm joined today by Marco Vuicic, the chief economist and VP at the American Dental Association. We're here in Atlanta at the annual meeting of the American Dental Association. Marco, welcome.
Thank
you again for joining us. Last year, we kicked off the Schein Chat series together, and have to appreciate that as well, Marco, because it's a series of communication that we've utilized now for this past year on many, many different topics, and I think we gave it a good start a year ago. When we talked last year, we recognized, of course, that you are a Canadian, and that I'm a hockey fan, and that we both know who Wayne Gretzky is. And one of the things that Wayne Gretzky has always said, that he didn't chase the puck, he didn't follow the puck. He actually anticipated where the puck was going to be.
Right.
And one of the things that's really interesting for us is to always be looking forward. And as the chief economist of the American Dental Association, and thinking about all of the different topics that are really important to the profession and to oral health in general and the population health, when you think about where we've been since last year, but also now thinking about where we can go together, or we might anticipate where things are going, what are some of the key topics that come to mind, the most important things that are on the mind of the profession today?
Well, first, thanks for having me, Jim. It's always a pleasure to chat, and hello to all the viewers. Let me take that in two parts. First, as you know, every year my group, the Health Policy Institute, updates a series of data sets and research that we're about to launch in 2 weeks from now. So let me give you a sneak peek, because there have been some interesting things that have happened the last year or so. So first, I think one of the big trends we're seeing is shifting dental care use patterns. And what I mean by that is we're seeing more and more children visiting the dentist and more seniors visiting the dentist. And in between
folks
that,
like myself, the seniors.
I say older Americans.
All right, older Americans, okay, yeah.
So children's dental care use is the highest it's ever been in history, and seniors as well is heading upward. But that 19 to 64-year-old population is still kind of stuck in this kind of flat line.
Can I just ask you just a quick question about the children? Do you think that it's primarily driven by the expanded care under Medicaid?
Yes.
In the Affordable Care
Absolutely,
Act?
and prior to the Affordable Care Act. The big gains have come in the lower income, lower middle income kids. But when we look at adults, especially younger adults, that 19 to 35-year-old age group, there we're still seeing kind of a flat line. Now, the good news is it was declining for many, many years, and it stopped declining. And just the last data point has seen a slight uptick. So I don't know, as a researcher and economist, it's too early to tell.
But we'll take that
whether that's
as
a
an
swing back.
That's right.
But there are some
That's
signs of optimism. On the practice side, we continue to see practice consolidation, dentists aggregating in larger groups, multi-specialty, multi-office practices. We can talk about that. I think that's a trend that will continue. And for the first time in several years, we've also seen a slight uptick in dentist earnings and dentist busyness. And again, that's after several years of a decline and stabilization. So signs of optimism in the latest data sets.
I think that's really great. You know, one of the things that we always look for is we always look for some data points that can reinforce our general enthusiasm that we always have for the dental profession and overall oral health, right, as a component of total health.
Yes.
You know, one of the things that you mentioned about seniors, at this point outside of Medicaid that we talked about with regard to children, when you look at funding or you look at reimbursement and how seniors pay, today there's really no coverage for oral health care in the Medicare program. Is that right?
Correct. Very, very limited, I would say. No routine dental coverage.
And so on the one hand, we have this segment of the population that if you ask them, is it important to go to the dentist and have good oral health, the average person like me and maybe some folks that are a little bit older than me will say, yeah, sure it is, but how am I going to pay for it? And so what do you think the prospects are as we look forward to actually have oral health coverage in the Medicare program?
So let me give a couple data points that help me form an answer to that, right? So first, like 5 years ago, and certainly not 2 years ago, we did not have the research we have today demonstrating the link between oral health and whole body health, and specifically the cost savings, right? So depending on what studies you look at, we don't go into that, but there's enough evidence suggesting that if, for example, diabetics, have their oral health managed, they do better on their kind of diabetes outcomes and medical care costs are lower. That evidence wasn't there 5 years ago. At the same time, I just told you dental care use among seniors is rising. And it's primarily paid out of pocket. You're totally right. About 27% of seniors have some form of dental coverage, the rest don't. So what I think is going on now is that first, older Americans are working longer, they're retaining coverage, they're retaining their teeth, right? Aesthetic standards are changing. All this is to me kind of pushing more dental care use among seniors. And there's more of them, right, with the baby boom. Now, when I look forward, I'm not so optimistic that all those trends will continue, and here's why. Because some of the economic data that I'm seeing is predicting that asset levels of seniors are going to kind of taper out, right? So an interesting tidbit, the fastest growth in educational debt is occurring among the 65 and older population. Right? So they're borrowing for their grandkids. But anyway, my point is, this is a source of uncertainty for me. We are seeing positive trends currently for seniors.
Doesn't that reinforce the need or the opportunity for somehow, the combination of the profession, other stakeholders, industry, to really work to have those that can make a difference in having Medicare coverage realize the long-term benefit of doing that?
I think it's time for that conversation, right? So I'm pretty disciplined. Like I want to get the facts and the research out and put that in front of policymakers in a very transparent way. But I absolutely agree, Jim. It's time for that conversation.
Because one of the things that I know that some in industry are doing is we're looking to gather a coalition of people, companies to bring this topic to the forefront. And I think also there is some evidence, there are a handful of insurance companies that actually have included an oral health benefit for certain situations where patients have a disease. And they're building evidence as well to say that the total cost of care when you have that component is less in a meaningful way. And one of the things that I heard, and I don't understand this exactly, but sometimes when a senior has a need for a medical procedure, but if they have an oral health infection, they actually might not be able to get the procedure. That might be a life-altering thing if in fact they can't get it. Is that?
There are cases of that. Again, I don't know how frequent or how predominant, but I've heard the same stories. But again, I haven't seen solid data or research on how frequent that is. But yeah, I feel because we're having a growing senior population, because of all that we've talked about, that we need to have a serious conversation about.
So we will remember that, and we'll find ways to partner together on that. So let me shift gears just a little bit. And when we think about other ways for us to engage that working age population that today isn't going to the dentist on a regular basis. They don't necessarily perceive that they have a need, and it's not high on the list in terms of what they're going to pay for. Consumerism is a big deal. People are much more informed, they're much more savvy, and they're much more interested in convenience and things of this nature, and how technology and ease of access can allow patients, working age patients, to say, I have a busy life, I have a lot going on. But you know what, this is kind of cool. I can actually get myself into the dentist and not have it be so disruptive. Do you feel that that's an important current dynamic, and as we look forward again to see where things are going, how we should be paying attention to that?
So I think that's a huge opportunity. And if you ask me top 3 things dentists should be thinking about, one of those is making it super easy and convenient for people to book online and to have appointments when they want. Like, face it, healthcare is changing, right? The patients are in charge now. Right. And I tell this to dentists all the time. The model is changing, right? The patients want things on their terms. So I think, and the data support this, right? So depending on what state you look at, this convenience of appointment times is certainly a major barrier to care for younger adults. In Illinois, it's number 2 after cost. So where I live. Right. So anything dentists and practices can do to kind of make information available online through mobile to do booking of appointments, predictions on out-of-pocket costs, right? That also addresses the financial issues. It's not so much cost, but uncertainty around cost. Right. Yeah. Right. So, I don't know how much Schein is doing in your practice management support for that, but it's certainly an area of opportunity.
Yeah. Well, thank you, Marco. Certainly for us at Henry Schein, we really believe that the practice management technology aspect of what we or any other company can provide to the dentist to help them effectively engage in patient relationship management, ease of access, actually patient demand generation, those kinds of tools in a practice management system are going to be more and more important. One of the things that we focus on when it comes to the business, and something that I think we're quite well aligned with the business of dentistry and also the profession of dentistry, is we really want to not only be a positive force in generating good economic results, but also good social results.
Right.
It's one of the things we love about being in this business and serving this profession. So this is a really long journey. And I think that this ongoing dialogue that we have with you in particular and the team that you are working with is extremely valuable to help us make sure that we're paying attention to where the puck is going. Right. And so that we catch up with it. So again, have to thank you so much again, Marco, for joining us.
Always a pleasure.
The invitation is always open to participate with us in Schein Chats. And we thank all the Facebook viewers for joining us today. And also remind you that at henryschein.com/Schein Chats, you can take a look at all of the Schein Chats that we have done during this past year. Thanks again, Marco. Great to be with you.